Welcome and welcome to the MEU Berlin Podcast. I'm your host today, Tabea, and I'm thrilled to bring you another insightful episode. Today, we're diving into a critical topic, healthcare and education for refugee women and women on the move. Joining me is a humanitarian worker by the name Erika Bernachi from Mexico, and she has extensive hands-on experience in the field. 13 years of experience, to be clear. Um, she has worked and focused on supporting some of the most vulnerable populations, refugee women and women on the move. And she brings a wealth of knowledge and personal stories to share. Join us as we explore her perspective on the challenges of providing healthcare to refugee women, both in camps and beyond. Let's get started. Welcome, Erika. Thank you for joining us, and thank you so much for your time today.
Thank you so much, Tabea. I'm so excited to share my knowledge and my experience. So thank you so much.
Thank you so much. I'm so excited to hear all about it. Maybe let's start with a question about yourself. Could you briefly introduce yourself? Tell us a bit about your background and your experience working with refugee women and what this work looks like in general.
Yes. So as you said, I'm from Mexico, and I started my experience in Mexico with vulnerable children. I started coordinating programs regarding health. Then I was directing the whole organization for different areas involving vulnerable children, education, health, distribution of NFIs for vulnerable schools. Then I also could see the perspective of how the government was working with refugees in Mexico from South America, from also the Mexicans that were repatriated from USA. I was participating in those programs. So then I started to create my, let's say my vision of how the government worked. Then also I was working at the same time with shelters that were supporting refugees in Mexico. Most of the shelters were very eye-opening for me because they were shelters that were placed by priests who saw people coming, a lot of people coming, and they just saw these needs, and they just started to provide food, and they were just relying on donations from the people. Then then I created an organization here in Mexico regarding women's health and also human development. We had these two programs for that, and we were also partnering with some vulnerable areas in Mexico, and we were partnering with community-based organizations who then were letting us being near the people and understand the needs before of that. Like we were understanding that if we wanted to do something, we needed to understand the needs before. Then I went to Athens to coordinate a medical NGO in which I saw a lot of people on the move, men, women, children, families from very different backgrounds, from not just from Syria, but also from Bangladesh, from Africa, from Afghanistan. And then I went to Syria, and there I also understood how internally displaced people, um, it's being like, what's their reality and what actually they confront once they are IDPs. Then also I worked there in a hospital in a refugee camp, and then I went to Serbia, and also I saw a whole new other different reality for people on the move there. We will speak more about in other questions.
Yeah.
And then I was a co-founder of Women's Healthcare on the Move, and we started our project also in Athens regarding women's reproductive health. And yes, like in general, that's it.
Okay. Well, that really is an extensive experience you have. Um, what you said you started working with refugees in Mexico, right? What were like the main driving forces in your work with refugees? Why did you start to do that? And then maybe also, how did you go from this like more local perspective in Mexico, where you're from, to like this international focus? What made you go to different places?
Thank you. So basically, I grew up in a family where my mom always took me to do different social services. So I say this because I saw a lot of different vulnerable stages in which people were living and they were going through. I was visiting sick people. Um, I was in retiring houses. I was with handicapped children. So I saw since I was 9 years old a lot of different realities.
Hmm.
But then once I went to the south border in Mexico, it was a life changing for me. It was before and an after. So I've never seen such a difficult reality until I met these people on the move. And they were just there. They were sharing their stories with us. We were supporting them with different like legal advice and all of this. But uh for me it was shocking, and I that's when I say, okay, I will do something with this. I will help in some way. So then that started my path. Like since before I was already in the organization helping vulnerable children, but then this came like as a cherry on top, like another mission I had in life. So then I started my path with that. I didn't know because in Mexico, it's not well known the humanitarian work. It's like you can just work in the UN and that's it.
Hmm.
So it's very difficult to understand. So I just followed my heart basically because I didn't know grassroots existed. I didn't
Oh,
know
yeah.
exactly. So I just started to also helping in shelters in here in Mexico and like that volunteering. And then I was still in my work with the National Migration Institute. So it was all basically following my heart. And then when I decided to go to Athens, I also didn't know, but somehow I felt it.
Hmm.
And a friend told me, "Hey, they are looking for a coordinator in Athens. Can you send your CV?" Then I sent my CV, and then I started 2 weeks later. I fly to
Yeah.
Athens.
Oh,
That's
wow. So
it.
that was very spontaneous, very quick.
Yes, very quick. Yes.
Okay, so um, you said you've worked with different organizations, right? And also co-founded one. Um, what are the missions of these organizations usually? How do they, because that is like the big topic today, how do they address healthcare for refugee women or generally for women on the move? How does that work?
So basically, the missions in from the NGOs I've been with, it's like the healthcare. It's a human right. We are not looking in your background. Are you a nice people? You're bad people. What did you do? Like what I've learned is that healthcare and humanitarian aid is a human right. Like you are not there to judge or to see beyond if this woman, if this man. So basically, all the missions and visions can involve that. And then, sorry, after that, what was the question?
So how does the work of these, or how do these organizations work? Like first it was the missions, and then how they address specific needs like healthcare, healthcare for women especially, and how they do their work in that regard.
So the way in which it's addressed, of course, it varies depending on the organization, but normally it's about uh, you need to prioritize. So first, when I was in Athens, it was like when we had a lot of people, most of them were men sometimes, it was like triage, prioritize. Because it was a lot. Like some nights we were having 100 patients one night. So it was triage, prioritize, referrals. Also, there was a lot of cooperations with NGOs, but I think that's another question furthermore.
Yeah.
And then regarding women, you also need to understand their reality and what they are going through, so you can also prioritize. It's always about them and it's not about you. Yes, you want to aid, to do some type of aid, but it's always about observing and hearing and understanding the situation they are. So if they come pregnant and they are very sick, okay, you prioritize like this woman needs to be referred to a hospital. And then by now you understand how you can actually refer it, even though she's a refugee, she has no papers. Like that's the thing, to want to prioritize and to be prepared for any emergency. Most of them are emergencies, uh but that's it, to understand the needs that they have at that moment.
Yeah, that makes a lot of sense too. I think you mentioned that before too in a different context, like to always observe what they need and ask what they need, and then do what you have to do.
Exactly.
So what are like the main challenges of actually providing healthcare? Like you mentioned that some of them don't have paper, don't have documents, and I think it's just me. Maybe if you don't have documents, you would be hesitant to actually go and seek help in an institution like a hospital out of fear to, I don't know, be deported or have something happen to you. So how do you make that happen?
So the main challenges are racism, for example, the fact that normally the refugees are portrayed as bad people, as people that they just come to steal, that they just come to do some type of hurt to the country or to the people in the country. And so, okay, what I have in my mind is this example in Serbia, that I was with this guy, and he had a very bad open wound, and uh, no one was free, just me, to take him to the hospital because everybody was doing the other stuff.
Yeah.
So I took him to the hospital. They trust NGOs. Like I mean, they don't have another option. So the fact that they trust you, you have a very big responsibility then too. Like if your responsibility was big, now it's bigger. So I took him. I understood already from my colleagues and because I was already in the field how this would work. So I stand up there and I say, this is an emergency and he doesn't need any paper. They just asked me for his name and etc. I gave his name, and then I push it through. Like, you need to check him. You need, and I was with him by his side all the time. It's not like, yay, they are gonna make him so happy. No, no. You need to stay there, and then to make sure that when he's out, you take care of him, that he returns to his squad or wherever outside he's staying, because they are staying in a very horrible conditions.
Mm-hmm.
So it was very hard because they were also racist with me because of my black hair. And I mean, it was two people that they didn't like us just because the way we look. So,
Oh, yeah.
but I stand very strong, and I say, you need to see him now, now, now. And then she started to shout because they shout a lot. And then I was like, well, are you gonna leave him that way? So then the doctor came out, and then I was like, what are you gonna do to him? Like I was very, you need to be very careful.
Yeah.
So then I came in with him, and he made me to translate to him. Then he didn't speak English, like Yusuf was his name.
Yeah.
And then I spoke 3 words in Arabic. So then I called an Arabic friend, and then, but you need to solve there.
Yeah, right.
And then, yeah, like they did the procedure. It was horrible because the anesthesia didn't work. I mean, it was a very traumatic experience. But then then he went very well. Like after then, MSF and other NGOs that were there,
Mm-hmm.
and MBI, were doing the follow up with him because they needed to clean it. And that's the amazingness of the cooperation in the field.
Yeah. Well, I'm happy to hear that that story had a happy end. Everything went
Yes,
well.
no, it had.
Yeah,
Yeah, yeah.
that's good. So this is like a little unrelated question. You mentioned the horrible conditions that these people were living in. Uh, I imagine that these conditions also have their influence on the health condition in general, right? So, yeah, maybe could you, I don't know, talk about that a
Yes.
little?
Yes, so basically, most of the refugees have scabies. So
Mhm.
it's type of an infection in the skin, and w- so it's very easy to take them out. Easy when you have a normal life, when you can take a shower, when you can wash
Yeah,
your
right.
clothes. So most when the scabies get very wrong, you start to get wounds,
Hmm.
and then you don't have water, you don't have a shower, you don't have a medic to clean it, you don't. So most of the work that some of the doctors do is like, it's wound care because of scabies or because they fell off, or but it's more scabies treatment.
Yeah.
So we were seeing a lot of which scabies treatment. And they live, for example, I had a phone call yesterday with a friend. They are an NGO that it's called Doctors with No, sorry, no Doctors with No Borders, something like that.
Yeah, yeah,
That
Doctors
they
Without
change.
Borders. Yeah.
No, it's not Doctors Without Borders. It's
Ah, okay.
Medics, No Border Medics.
Ah,
Yeah, yeah,
okay.
yeah.
Yeah, yeah.
MSF is No Border Medics, and then
Hmm.
they are in Calais.
Hmm.
And she told me the situation is so bad. Like the scabies situation is so bad because they live in the jungle.
Oh, yeah.
So yeah, I hope that answered the question.
It did. Yeah. Thank you. Um, like you've mentioned now a lot of time that you work with different organizations, different NGOs, and that you all work together. How does that look like, this cooperation?
So yeah, I mean, I think that was the thing that most filled my heart when I arrived to Athens the first time, to see how we were all in the field helping each other. For example, I was in MBI, that they were it was a medical NGO, and then there was another NGO working inside a camp. And then she was also texting me, "Hey, Erika, I need this this kid needs this medicine ASAP. Do you have it?" And the most amazing part is that, let me check in the if we have it, or if someone has it. And then that was the easy part, that we were all just like, no, no, let me wait. Like, oh my god, the kid needs the medicine.
Hmm.
So yes, yes. So I asked the medics if that was okay. We check it. Like, it was also not just because all of a sudden I feel I'm a doctor, because I'm not. But of course, we did it with the cautions that needed to be done. But it was like, yeah, here is, and the doctors told me he needs this treatment probably.
Mm-hmm.
And we gave the whole box, for example. Then, hey guys, we have an emergency here. This is a woman who has, like, I don't know, this health problem, and everyone who was on call was answering and going. That's in the small, like, I could say in the one-on-one, but in the big one, we were like all colliding efforts.
Yeah.
MSF, MBI, all the other medical organizations, we were gathering, we were seeing, we were colliding efforts, we were not doubling the work. So also, yeah, for example, an NGO who was just providing education for children, they
Mm-hmm.
needed children to be treated. So okay, we can go once a week to check your
Yeah.
children. You know, this
Yeah.
is that the type of cooperation.
Yeah. But it also makes a lot of sense because you're all working with like limited resources, right? And not just,
Exactly.
yeah, not just as in like things you have, but also like people who are there because you said like not everyone is a medic. There is doctors, but then there's people that are just there to help who don't have maybe the medical background. So obviously you need to work together. Um, since like not everyone is a medic, right? The teams, I guess, are very like multi-professional, very diverse. How does that work? How do they make that work?
So most of the medical NGOs, all of them are medics except for the project coordinator, and that's it. Like, it was me,
Mhm.
and then all the other NGOs, also MSF, MDM, have the admin staff that it's not medic.
Yeah.
But then you have these other NGOs who work with distribution. I was working for an NGO that does distribution, wash, and all of these. Um, so that's the same way. So we knew which NGOs were in the field. So you create these partnerships. And then, so the medics are these ones, the distribution ones are these ones. And of course, Athens is like, it has a lot of NGOs, but a place like Serbia, it depends. It's very difficult to be there.
Hmm.
So the same, you collide efforts, and then even you can go together to the different spots, and the medics are here, and then the distribution is here, the showers are there. So yeah, I mean, once a volunteer that it's not a medic understands what the other NGO is doing, as you said, it makes sense that the cooperation keeps on going,
Yeah.
and they understand.
Okay, yeah. Thank you. Um, so this is a topic that didn't come up that much yet, but that we also wanted to talk about, and that's education, because I think some of the organizations you worked with, they had like focus on healthcare and education, right? What does that entail?
So basically, it's it's more about when, okay, you are a woman, but then that doesn't mean that you know all about health or reproductive health, because this is a very new topic, and it's still taboo in so many different countries. So not even myself, I knew about my hormones, and then when they are even more in this stage of that, they are refugees, so they are on the move, they have questions too, but they need to make the best decisions even in these times. So for example, when it's in emergency context, you just give very fast advice of, no, don't do that, like, have more hygiene, try to do this with a pad,
Hmm.
or with STDs, you distribute some type of um material, or you know
Yeah.
to prevent.
Hmm.
But then when you are in a stage where they are already refugees in Athens, for example, they are already refugees, they had accommodation, they are starting to build a life there. Then also it starts the pregnancy, breastfeeding. So they ask a lot about, I'm so stressed, but then I'm breastfeeding. What should I do? And they want me to give me this medicine for stress, but I don't want to. Okay, so education comes again with the needs that they have and
Mm-hmm.
with the expertise of a medic or a nurse or a health practitioner. Okay, you are a refugee here. Like, you don't say that to them, but you understand that depending on their culture, if they are from Africa, what do they normally eat? What can they eat here? What can you adapt in their nutrition? So, okay, I think they eat a lot of fufu, something like
Mm-hmm.
that.
Yeah.
And then it's like, don't eat that much fufu, probably just in the morning, probably just, and then, and for example, if it's Muslim, okay, don't drink your chai with a lot of sugar, for example.
Mm-hmm.
So, but you start to give this type of explanation. So what's happening now that you're breastfeeding? So what is it good to not have that much sugar? And then you adapt their needs with the situation they are and the country they are in,
Mm-hmm.
colliding
Yeah,
it with
makes
their
sense.
culture and their customs.
Yeah, thank you for that answer. Very insightful. Um, you have worked in Greece, you've said, in Athens, right? Which we all remember was a hotspot for refugees, and um, there were there was a, there were a lot of opinions about it in the European Union. And maybe what were your insights? How did or how do European Union policies impact the work of organizations in the field?
What I can say and what I was saying is that, um, like around 2019, NGOs there were getting a lot of support. From my perspective, it was still like, okay, even from Greeks, they were getting a lot of support. And but then what happened 2023, 2024, I could start seeing a lot of NGOs shutting down
Mhm.
because of the word of mouth in the media that um they were saying. I think in the Greek media they were saying, they were speaking very bad about NGOs. I mean, you know how this works. Like, they place one case that it's bad, and then all of
Yeah.
the NGOs were bad. So it's very sad to see still now that a lot of NGOs they need to close because of the lack of funding, and this is a consequence of uh, a bad wording, like a bad spreading of words
Hmm.
um, about them. When, I mean, NGOs are not perfect and refugees are not perfect. Non-human being is perfect, but the fact that you create this campaign of, no, no, they are all bad, they are all bad, and then you somehow start to treat them even bad, like even harassing them or worse.
Hmm.
uh, I don't think that's fair, and I think policies or media started to create those type of things um, that were happening in the field. I mean, I can see now that they are other NGOs there, and it's okay, and they have managed to stay, and that's amazing. But it was not fair what I was hearing from other people.
Hmm.
Um, and I mean, Greeks are amazing. Like, I don't want this to be like, oh, Serbians or Greeks, or we cannot generalize. Like, this world and countries are full of people who have different perspectives. So there are also a lot of Greeks helping and supporting, and they are very nice. But some of the others that have listened or heard a lot of the media stuff, well, that was not helpful for,
Yeah.
like, it created a big impact. Therefore, many NGOs needed to close.
Okay, yeah, that's sad to hear.
Yeah.
Is there anything where you think that could be done to help better the situation again?
I mean, to pay attention what is being said in the media, because also in countries like Serbia, they were saying that refugees were rapists, and then you were seeing policemen just beating them in the night, like refugees, just because one, it's a bad person, and we don't even know if the story was like, we
Mhm.
don't even know the story, but then they create these, oh, they are bad people. And then I think, I mean, Serbia is not part of the EU, but I think in Athens at least, they will need to be more conscious of what they say and what they place in the media, because that creates a lot of aggressiveness. Also, like, you want refugees to be treated as they deserve because they are human beings, but if they are being treated bad, they will answer, they will respond. Like, of course they will not smile, they will say something. I'm not
Mhm.
saying that this is a reason for also for them to do bad things, no, but you are not creating this balance or this peaceful way of helping or coping with a very already difficult situation. So I will say they will be more responsible of what's being said in media. Or if they cannot be, people, they are welcome to come and see what's happening in the NGOs. They are very welcome.
Yeah,
So yeah.
right. It's hard to have proper, I don't know, opinion without experience about it, right? Like you can say whatever you want, but if you haven't seen what it's like, then it's yeah, hard to, I don't know. Yeah, right. Um, so you've worked in very different contexts. Like you've been in Athens, you've been in Serbia, but also in Syria, you said, right? Um, and Egypt, I think you mentioned to me. Yeah.
Mhm.
So how are these regions different from each other? How are the situations different from each other?
This is such a nice question, because I think we are in a world where we like to generalize, like all of us, like Latin Americans, they are the same. I'm like, no, we're not. Europeans, they are the same. So once I was in Egypt, it was very different for me than Syria or Iraq, because they have been through a lot. So the situation there is difficult. The economic situation is very bad. I have a friend that she says, like, Egyptians are very resilient, and I think they are. So they are dealing with a lot of um, wars or very tense situations. They are surrounding them all the time.
Yeah.
So the people is amazing. They are very resilient, and they know how to cope with these type of situations because they have no other chance or other way.
Mhm.
But at the same time, they are very generous. Like, this is people that they are dealing with very bad stuff, but they are still, Egyptians work a lot for themselves too. Like, they help each other. So what I saw in local NGOs there, it's amazing. They know what they are lacking for in terms of human development, mental health. They know. and they do something. So that's what I liked a lot about them. And then also they had the Gaza war started there.
Yeah.
So they what I could see there is like, hey guys, there's a family who needs help, I help. Hey guys, there's a family who needs accommodation, I help. Hey guys, so the word was spreading so much, they were helping so much, and that's where you can see the real soul of a country. That also
Mhm.
they have their faults, yeah, their flaws, and yeah, nobody's perfect, but I could see a country that wants to, that it's working for a better. I mean, if you cannot control what the other organizations or the other actors around you are gonna do, they are doing what they can do. It's like work on themselves.
Yeah, right. That is the one thing you can always do.
Mm-hmm,
Yeah.
mm-hmm.
Um, so we already talked about like women having specific needs that might be a little different from men or other people, just because like we have reproductive health and breastfeeding, pregnancies. Um, what And we've talked a little about education about reproductive health for women, because depending on which culture they came from, they might not have known a lot about it. And as we all know, reproductive health is a topic that only got a lot of attention like a short while ago.
Mm-hmm.
Like it has not been extensively discussed or yeah, taught. So how does that, or let me rephrase that, um, which challenges does that bring in the different regions?
Very good. So yes, for example, you cannot start speaking about reproductive health just very openly with a woman that you understand that in the religion it's a taboo. Or so you start, that is why you start asking about general health problems, and then all of a sudden they will also open up about like, yeah, well, actually I have questions about this. And but it's all about how respect also you show towards their religion, the traditions they follow. So it's all about, I think all woman wants to have questions about this, or they are realizing that they don't know. Me too, I was the same. So it's all about how also saves the safe space you create for them. So if you want to ask a woman about reproductive health in a camp, when everybody is like listening,
Mhm.
no, like
Yeah.
no, habibi, that will not work out. So it's all about you being aware. How are you gonna create the set? How are you gonna make them feel safe? Uh, and so then you can start to speak about, yeah, your hormones, this other stuff. And yeah, it's about also for you to understand, to not place them in a more vulnerable situation. Like
Mhm.
if there is this doctor in this camp, it's a private set, and then he is asking very loud to a woman who clearly uh, has a different religion, and then the other man, it's in another patient who's a man, it's in the other room, that it's not a room, it's just like a cover, and you ask very loudly, okay, no, please, like
Yeah.
this is basic stuff. Like no, you don't do that. First it should be a woman doctor, and then it
Mhm.
should be very not loud.
Yeah.
So,
Yeah, like you have to be respectful and
because
okay.
this goes beyond us. You can actually create a security problem for her.
Right,
Like,
yeah.
camps are not a safe place for anybody. So if he hears, she can be in very, very big problems.
Hmm.
So it's all about, I think it's about an onboarding, a good training, a good understanding on what you're gonna do.
Yeah, that
Yes,
makes sense. Yeah. Yeah, right. Because that would be very counterproductive to put someone on the spot and like in a more vulnerable position when they are already in such a vulnerable position in the first place. That would just, yeah.
exactly. And I mean, they know how we think. We know how they think. This is not a way of creating war or conflict. We
Hmm.
respect everybody. Uh, so normally, if you are gonna provide any type of aid, you are the responsible one,
Right. Yeah,
not them.
that
So,
makes sense. Yeah.
mhm.
So yeah, like right now we've heard that that is a specific problem or challenge that you face when you're working with refugee women in camps. Do you think that being in a camp is an obstacle in providing healthcare to women?
Yes. Um, Depending on the camp, but I mean, most of the camps, I need to think about this.
Hmm.
I mean, you have big NGOs being able to be inside the camps, but sometimes these NGOs have a lot of work too, so they can just attend what it's like the emergency, as I said, or they prioritize. And then if you're adding that reproductive health, it's just in 2024, 2023 being now spoken about, and it's like a new topic all of a sudden. Uh, it's a difficult place to be a woman. I mean, I need to choose my words very well because many organizations are working in favor of it. Like, they
Hmm.
are amazing organizations in Athens, but they still have a lot of work. Like, they need more support.
Hmm.
And when you're in a camp, I mean, I'm not sure how well you can follow a treatment or have a good hygiene. I mean, they are very clean, but how much water they provide to them. Uh, the camp I was working in Syria, I mean, it was in the desert. So the situation is very difficult.
Hmm.
Somehow I don't know how to, yeah, the answer will be, if being a woman is a target for everybody of us in the world,
Yeah.
then being inside a camp with some different ideas of what a woman should be or what a woman should say. I mean, the least thing you want is to speak about reproductive health because you are focused on surviving.
Mhm. Right, yeah, because they all think they have bigger problems at hand.
Yeah. So I think right now what is happening in Athens and what was happening before with these amazing NGOs, they started to create this safe space to speak about all of this. Uh, but in a camp, I must say, from my experience, probably there are other camps. It's still a work in progress.
Hmm. Yeah. Okay. So since it's a work in progress, what would, based on your experience, be a solution or a way forward to improve healthcare and education for women?
I will say better training for volunteers that would like to do that, like, or a training, a training, and then you will have more people helping on this. But also support for this type of organizations, money wise, donations wise, and in camps also to attend very specifically the funding to provide this reproductive health. And it's all about organizing. I don't know, to add in the budget reproductive health, but to be aware and to understand that we don't want to create more problems, or we don't want to create more crises. And if you create a health crisis, a reproductive health crisis, then the whole family will be in trouble. So if we can see it more as if this will prevent more problems, you will focus on it. You will put all your efforts on it. So reproductive health should cover education and medical attention, both collided, because women need to also understand what's happening in their bodies, and they should be able to make their own decisions. But once we understand that this will prevent a whole new crisis of health, this is when the support will increase for these programs.
Yeah, that makes sense. Yeah. I also always think it's very important to have education on different topics, anything, so that you can make decisions for yourself, educated decisions for yourself, where you go, so okay, this is the situation, I understand the situation, and this is what I want to do about it based on all that information I know. Yeah.
Exactly, on accurate information, and in their language, in their, like, everything should be given in a very dignified way. But that requires effort as everything. So also a big crisis will require an effort. So I don't think it's as difficult.
Okay. So coming to a close now, maybe what is the most rewarding thing to also speak about, like something positive of this work, this humanitarian work?
I think it connects you with your humanity every day. Like, you become more, you see the world different, you become more aware of the people around you, everybody. It connects you more with your spirit, basically. Like, you understand also what's important in life. And I don't know, it creates you this awareness and this type of, you look at things differently, and you look at cultures differently. I love cultures now. Like, I know them so deep now. Well, not as deep, but I will say that I've been surrounded by a lot of friends, nice friends, that were like open their homes for me. I also, I'm amazed of how beautiful this world is, and how the cultures make this world more beautiful, more colorful. So it has created in me much more more sense of humanity.
Yeah, that's a nice answer. I really like that.
Thank you.
Yeah. So yeah, well, thank you again so much for your time and your insights into this, and for sharing your experiences with us.
Thank you too, and you're welcome. Really, the work you are doing is it's great. I think we need to be able to speak of what we see and to share.
Yeah,
And this is also hard work what you're doing. So,
thank you.
uh, I mean, yeah, thank you too for letting me share.
Thank you so much.